a lot of things have happened since that meeting, Phil. You brought up a couple of them. One, this question about death boards or whatever. It's really not, I think that was an inappropriate term that might have been applied to something. But President Obama himself said that the chronically ill and those towards the end of their lives are accounting for potentially 80% of the total health care bill out there. There's going to have to be a conversation that is guided by doctors, scientists, and ethicists. And it's headed towards that. You can't insure 50 million more people and not tax the resources of this country. And someone is going to be put in a position to make decisions about what people are going to get. It's going to happen. It may not be in the 1,000-page bill with 3,200 that you guys have worked up, but it's there. It's coming. And I think people understand that. I think they understand that it's coming, and they're scared to death. The other part of this is that I guess the mean-spirited attacks that have been made on the public. People that are coming to these kinds of meetings and want to have a dialogue. You know, your leaders have made some really disparaging remarks about people. And it's really, it is. It's mean-spirited. I don't come here as a voice of some special interest. I'm a self-employed business person. I'm a cancer survivor. I'm concerned. I employ 60 people. I don't know how I'm going to afford to provide health care insurance to them, but you're going to mandate. You know, we're tearing apart a system that doesn't need to be torn apart. You take the 48 million people that are uninsured in this country. When you break it down to who are those people? Who are those people? Do you know who those people are? And it's not a pop quiz. But people that have looked into it, there's not 48 million really uninsured people in this country. There's only about 15. And how do we address that problem? We're addressing a problem of 48 million people who, you say the illegal immigrants and people that are here aren't covered. They're going to come to get health insurance. California, New Mexico, Arizona, Texas, the healthcare systems are broken in those states. They're driven out of business because people come across the border to get health care. And they're running those hospitals in those states deeply, deeply in debt.
Let me just part of this before I forget my thought. You're absolutely right on the question of illegal immigrants. You can write it in the bill, and you did. When that person comes into the hospital, usually the first question, and they're bleeding, the doctor and the nurses and the folks are going to take care of them. This is why, and I think what we've got to do, and we have to do it very soon, is we've got to get a hold of comprehensive immigration reform in the Congress. We have done nothing. And I've been there for 3 years, and the minute you start talking about it, everybody starts getting nervous in the service. And I said, well, to do nothing. I mean, because you're absolutely right. If we don't, but this problem will not solve itself until we have the courage to talk about and pass tough immigration reform laws in this country. Secondly, you're right about people casting, saying some very bad things about people to come and look. People are fearful, and I don't blame them. I mean, they're inundated on both sides. Yesterday, I was in Quincy, and it was pretty loud. And I will be honest with you. I mean, right out of the chute, a guy in the front before I even opened up the meeting said, I want to know right now, are you willing to take a lie detector test? And I said, and first of all, I thought, I was angry because I said, I was thinking to myself, where'd that come from? But I said, well, sure, and I'll take a drug test too, but can we talk about health care? And I said, look, I understand why he's as angry as he is. I do. But look, we're people too, and I'm pretty thick-skinned. And I've been hollered at before. It wasn't the first time, it won't be the last time. But part of this, too, is about being in a democracy to let people say what's on their minds. I mean, if I get hollered at, it doesn't make my day, I'll tell you that. But I don't go home and it comes with the curve. And I think to try to cast, to talk down to people, even if you want them to be polite, but they're nervous and they're angry. Why not? Take a look at this state. It's a wreck. It's 11 billion plus upside down. They're talking about cutting services to the most needy people we have. And here we have, I'm a Democrat, but here you have a Democratic governor, a Democratic House, a Democratic Senate. Out there, same thing, Democratic President, Democratic House, Democratic Senate. I mean, the message changes too. I mean, we're out here having these. There's some members that won't do it because because they think it's going to be too rowdy, or they're going to be in some sort of danger by coming home and talking to people. Well, look, you're my boss, and I'm just trying to do the right thing to represent you. Now, I realize every time I put my card in, I've made a third of the people that live in this district mad about something, and I get that. But I would never want to silence. That's why I'm doing 2 more today. I will have done 18 of these. It's my second round and 2 telephone town hall meetings. Why? Some person said, well, why did you even bother coming if this bill isn't going to be the bill? I said, because, A, I want you to know at least where the house is at here. Should I just stay home and not come out and tell you about it? And then you can, but I'll tell you one thing that we should have done, and we didn't. And I think it would have helped. We should have put out a fact sheet to the American people. And they don't have to believe anything that's written on it. But for heaven's sakes, I can order you all a copy of the bill. And if you want to read Gone with the Wind, you'll get it done faster than this. Why? We should have given you a fact sheet about the bill, similar to kind of maybe a couple pages. And then, if you didn't believe anything written on it, at least we gave you what we believe to be in the bill that's factual. You could tear it up, throw it away, or you could keep it, but it would keep it simple for ordinary people to understand. I'm telling you, I sat in that markup, as I said, for over 27 and a half hours, and there were terms in there. I'm not a doctor, and
that's exactly the plain language. Why does it take 1,000 pages?
Well, it takes 1,000 pages because you have amendments. Like my amendment that I explained in 30 seconds to you, or a minute, had to be written up in 2.5 pages because of technical language that you have to put in an amendment in the bill. But we should have made it very simple for ordinary people to understand.